This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Hhlite Cream is designed to treat moderate to severe melasma. This cream is formulated with effective ingredients to lighten dark spots and improve skin appearance. Indications and uses. This formulation is indicated for adults managing moderate to severe melasma, a condition that results in symmetrical brown patches on sun-exposed areas of the skin, particularly the face. It is vital to combine treatment with sun protection measures, such as using sunscreen and wearing protective clothing to achieve optimal results. How it works. The cream works effectively by utilizing hydroquinone to inhibit melanin production, tretinoin to rejuvenate and repair sun-damaged skin, and mometasone to reduce inflammation and irritation. Directions for use. Apply this cream as prescribed by your physician, ensuring it is for external use only. Begin by washing your hands and cleansing your face with a mild soap. After drying your face, apply the cream at night and gently massage it into the skin until fully absorbed. Avoid contact with sensitive areas such as the eyes, nose, and mouth. Sun exposure should be minimized while undergoing treatment to prevent repigmentation. Possible side effects. Common side effects may include mild burning, stinging, redness, and dryness. If any of these symptoms worsen or do not improve, it is crucial to consult a healthcare professional. Precautions and warnings. Users should exercise caution if they have pre-existing conditions such as liver, kidney, lung, or heart diseases. The cream is not recommended for pregnant or breastfeeding women without consulting a doctor. Additionally, it should not be used in children under 12 years of age or on those who are allergic to any of its ingredients. FAQs. 1. What is Hhlite Cream used for? It is used for the management of moderate to severe melasma. 2. How should it be applied? Apply as advised by your physician, ensuring it's for external use only. 3. Are there any precautions while using it? Yes, reduce sun exposure and use sunscreen. 4. Can it be used on wounds? No, it should not be applied to wounds or ulcerated skin. Thank you for watching. If you have any questions or suggestions, please leave a comment below. We appreciate your feedback and support.